Hello everyone. You have studied adrenal receptor agonist. So in this chapter, you are going to study adrenal receptor blocking drugs. And this drug also can be called by adrenergic antagonist. Oh, here, there is a QR code. You can scan this QR code and reply PD and tap the work number 3904. This is my work number. You can evaluate my teaching. Thank you. Now, the drug adrenergic antagonist, the classification, it also is similar to the other agonist or antagonist. This is based on the selectivity to the receptors. So these adrenal receptor antagonists include alpha receptor blockers and beta receptor blockers. And these different families of drugs also can be divided into non-selective alpha receptor blockers and selective alpha 1 or selective alpha 2 receptor blockers. And the beta receptor blockers also include non-selective beta receptor blockers and beta 1 selective or beta 2 receptor selective blockers. And here you can know this. These three drugs for you in this chapter, they are more important. As one alpha receptor antagonist, this phentolamine is the representative drug, and parazosin it is one alpha 1 selective antagonist drug, and the propranolol, this is the representative drug of non-selective beta receptor antagonist. So at least you first remember these drug name and their characteristics. Before I introduce the drugs, you also need to review this knowledge, effects of adrenal receptor subtypes in different tissues. Now look at, maybe you still remember this. Alpha 1 receptor, mainly resides in smooth muscle, especially many blood vessels. It induces vasoconstriction, increased blood pressure. And the alpha 2 receptor mainly in presynaptic membrane, and it has a negative feedback in the regulation of the neurotransmitter release. So once it is activated, neurotransmitter release can be decreased. Beta 1, it mainly resides in heart. It also resides in kidney. So increased heart function, increased heart rate, even promotes the AV conduction, so increase the cardiac cells work, increase oxygen consumption, and promotes the release of renin, increase the function of RAAs. Beta 2 receptor, similar to alpha 1 receptor, it mainly resides in many smooth muscle, including respiratory system, uterine smooth muscle, or vascular smooth muscle. But the effects caused by beta 2 receptor is opposite to alpha 1. It always induces vasodilation, relaxation of smooth muscle. So it induces vasodilation and bronchodilation. And this beta 2 also resides in liver and pancreatic islet beta cells. So it is related to metabolism. It can increase blood glucose, increase the lipolysis, so also increase the oxygen consumption of tissue, BMR increased. And actually, alpha 1 and beta 3 receptors also related to metabolism. Dopamine 1 receptor is in smooth muscle and induces relaxation of smooth muscle, especially kidney, the blood vessels, induce vasodilation. So this is the effects caused by activation of these receptors. So if some drugs are these receptors antagonists, their effects just opposite to these effects, just opposite to this. So here, now, the blockers. If alpha-1 is blocked by drugs, so it will induce smooth muscle dilation, smooth muscle relaxation. So on the blood vessels, it will induce vasodilation. Blood pressure may be decreased. But in the whole body, the body will stop, inhibit this obvious change on the blood pressure. So don't forget, there is a reflex in the whole body. Maybe this reflex act on the heart, induce a tachycardia. Alpha-2 receptor, once it is inhibited by some antagonist, it's negative feedback in the regulation of the neurotransmitter release. This result is inhibited, so it can enhance norepinephrine release from nerve terminal. In the heart, once beta-1 is blocked, so it induces negative effect on the heart. Decreased heart rate, decreased contractility, decreased oxygen consumption, decreased cardiac output. It also can decrease the renin release, decrease the function of RAAS. Beta-2 receptor, if it is blocked by antagonist, it induces smooth muscle contraction. So especially in the respiratory system, it can increase the IV resistance. This is a bad result, for the patients with respiratory system disease. And it also inhibit the metabolism. So maybe also affect blood glucose in plasma, decrease the lipolysis, decrease oxygen consumption of the tissues. These are the effects of blocking adrenergic receptors in different tissues. So when you know the drug, it is what receptor antagonist, you can guess what the pharmacological effect caused by these antagonists, right? So try to remember the distributions and their functions of these receptors. Okay. Alpha receptor antagonist drugs, based on their mechanism, the drug include two groups: reversible alpha receptor antagonist and irreversible alpha receptor antagonist. In this group, phentolamine, it is the representative drug. It is also non-selective antagonist. And telazolene. This one is irreversible, non-competitive alpha receptor antagonist, Phenoxy Benzomine. And based on the selectivity to the subtype of alpha receptor, this drug also can be divided into this, alpha-1 selective antagonist. The representative drug in this group is pyrazosine, and the alpha-2 receptor antagonist, yohimbine. So here, based on this slide, I just give these two drug names in red color. It means these two drugs are more important in this chapter. Okay, so what are the effects, clinical uses, and adverse effects of alpha receptor antagonists? Let's go on study. The representative drug of non-selective alpha receptor blockers is phentolamine. Phentolamine and trazodone, both of them are potent competitive antagonists at alpha-1 and alpha-2 receptor. Competitive antagonists. The effect on the alpha receptor, its effect mainly on the cardiovascular system. So the first effect is cardiovascular effects. Because of blockade of alpha-1 receptor in the blood vessels, it can induce vasodilation, so decrease peripheral resistance. The result is decreased blood pressure. So don't forget, in the body, this is the whole body. Once blood pressure decrease or increase very obvious, the body always mobilizes the mechanism to stop that response, that change. Yeah. So it also has heart stimulation. This mechanism includes two kinds. One is from blockade of alpha-1 receptor, because it induces vasodilation, decrease peripheral resistance, decrease blood pressure. So in the body, there is a reflex activation of sympathetic stimulation. Increased sympathetic stimulation. This effect acts on the heart. It will induce a positive effect on the heart. So it is cardiac stimulation. Maybe heart rate increase by this. Another mechanism, it is because this drug also can block alpha-2 receptor. Remember, alpha-2 receptor is in presynaptic membrane. Alpha-2 is related to the neurotransmitter release, but its function is negative feedback regulation. So when it is blocked by phentolamine, it can promote the release of norepinephrine from the nerve terminal. So this neurotransmitter can act on the heart. It also can activate beta-1 receptor. It is unlocked by phentolamine. So it also induces the same result like this, cardiac stimulation. So usually, phentolamine acts on the heart rate increased before using this drug. Understand? So that's why, although this drug can decrease blood pressure, obviously, because it has an obvious cardiac stimulation on the heart, so increased heart rate. This result is not suitable in the treatment of hypertension. So although this phentolamine, it has ability to decrease blood pressure, but it cannot work as an antihypertensive drugs. When you study antihypertensive drugs, you will not study phentolamine in that chapter because of cardiac stimulation. Okay, now, next effect. Phentolamine works as the alpha receptor blockers. It has a phenomenon, induces a phenomenon. We call this is epinephrine reversal. This can be a concept for you. You should know what does it mean. Epinephrine reversal. Now, let me explain with these figures. Okay, now look at it. These are catecholamines, you have studied last time. Epinephrine, norepinephrine, and isoprene. These curves caused by them just used once intravenous injection. Use these catecholamines once intravenous injection on the dog. Yeah. Blood pressure change like this. It means a dose of these catecholamines, the blood pressure change like these curves. This group of the curves is caused by pre-treatment with an alpha receptor blockers before administer this drug, and then administer a dose of epinephrine. Dose is similar like this. Understand? Means before administer this epinephrine, before administration of these catecholamines, first use these alpha receptor blockers, and then the blood pressure change caused by these catecholamines will be like this. This is pre-treatment with beta receptor blockers, and then administer one dose of these catecholamines, blood pressure change like in these curves. Okay, now look at what does it mean of epinephrine reversal. Now look at when just use epinephrine once, it often means the dose large enough. You use the epinephrine in relatively high dose. Remember in the last section I introduced this always induce the initial increase of blood pressure followed by a little decrease of blood pressure. Understand? After intravenous injection, a dose of epinephrine, at the beginning, the drug concentration in the plasma is relatively high. It is similar to high dose of epinephrine. So, because of alpha receptor activation in the blood vessels, induce an obvious vasoconstriction, so blood pressure increase obviously. But with the drug elimination in the body, epinephrine concentration in plasma is relatively low. So the effect similar to a low dose of epinephrine. At these conditions, beta receptor effect predominate. So beta 2 induced vasodilation predominate. So at this period, blood pressure even lower than the normal state before administration of epinephrine. Understand? So a dose of epinephrine after intravenous injection, it often induces a two phases blood pressure change. One phase is increase, followed by a phase decrease. Understand? But before administration of epinephrine, if you administer a dose of alpha receptor blockers and then you administer epinephrine, the dose is same as this. So the blood pressure will change like this, just decrease. This phase 1 increase of blood pressure disappeared. So actually, when it is alone, the typical change of blood pressure, it is increase. This is the major part. But here, it disappeared. It just decreased blood pressure. So we call this conversion from the increase to decrease. We call this phenomenon by epinephrine reversal because it is caused by alpha receptor blockers. This is the epinephrine reversal by alpha receptor blockers, phentolamine. Do you understand? So try to remember this concept. First to understand what does it mean, and then you can use your own words to describe. Understand? So actually, when textbook tell you how to state this? Epinephrine reversal. It means conversion of the pressure response to epinephrine to a blood pressure lowering effect. Blood pressure lowering effect. It caused by alpha receptor blockers, which unmask the beta-2 effects of epinephrine. You know, this part, phase 2, it mainly caused by beta-2 receptor. So alpha receptor has no effect on beta-2. So convert this phase 1 in typical increase of blood pressure into decrease blood pressure, the pressure lowering effect. So this conversion is caused by epinephrine reversal. It's very useful. So here you can understand, once some drugs like alpha blockers used to overdose, induce a hypotension. Actually, at these conditions, hypotension caused by some alpha receptor blockers, you cannot use epinephrine to save the patient's life, because it will further decrease blood pressure. Understand? But at that conditions, when some patients has hypotension caused by some alpha receptor blockers, you can choose non-epinephrine to treat. Because when we use non-epinephrine alone, the blood pressure alteration is just increase. Just one phase, only increase, no others. So when we use this alpha receptor blocker pre-treatment with this, and then administer the same dose as this used alone of epinephrine, the blood pressure change still maintain a little increase. Because now epinephrine not only activate alpha receptor, it also can activate beta-1 receptor. That result also increase blood pressure. So for alpha receptor antagonist intoxication, the patient has hypotension, you can use non-epinephrine to correct the blood pressure. Understand? Remember this. Now look at isoprenaline. Because this drug is beta receptor blockers, so pre-treatment with an alpha blockers has no obvious change. These two curves are same. But these curves caused by pre-treatment with beta receptor blockers. Can you understand? Okay, this is epinephrine reversal. Okay, actually phentolamine, this drug has very less selectivity to the receptors, very less specificity to the receptors. Not only block alpha receptor, it also is one M receptor and histamine 1 and histamine 2 receptor agonist. Not only block alpha 1 receptor, alpha 2 receptor, it also activate M and histamine receptors. So it induces parasympathetic effects similar to the effect caused by acetylcholine, especially on the GI tract, has gastrointestinal stimulation and histamine-like effects because it can activate its histamine 1 and 2 receptors, increase peripheral vasodilation, because especially this H1 receptor, it also mediated vasodilation. And histamine 2 receptor, it is related to gastric acid secretion, so it can promote this secretion. Actually, this effect on the M receptor and histamine receptors is relatively weaker than the blockade of alpha receptor. So that's why these parasympathetic effects and histamine-like effects caused by phentolamine, usually they cannot used to treat some disease. Because of blockade of alpha receptor, that effects are more obvious than this. So these effects just contribute to the adverse effect. So here, based on these pharmacological effects caused by phentolamine, can you guys, what are the clinical uses and adverse effects of phentolamine? Let's go on. Clinical uses of phentolamine. Phentolamine mainly block alpha receptor induced vasodilation. So based on this response, it can be used to treat peripheral vascular occlusive disease. Actually, this disease like acroarterial spasm disease or thromboangiitis, obliterans, or sequela of frostbite, or Raynaud phenomenon. Look at this. This often means acroarterial spasm disease. The small arterial circulation is not good enough. So this disease actually like Raynaud phenomenon. It occurs more in the female, especially the woman at 20 to 40 age. Because of bad circulation at the ending of the fingertips, especially in their cold weather, like in winter or autumn in North China, often feel very pain in the fingertips. So like this pictures show, after ice water test or clenching fist test, fingers are pale, fingertips are cyanosis. Now you can clench your fist and make this test. When you lose your fingertips, recover the blood circulation very soon, and the color of the fingers convert into red is very soon, because your hand is normal. But for the patients with this Raynaud phenomenon, after this clenching fist test, fingers are pale and the fingertips are cyanosis, because of circulation of the finger or the fingertips is not enough to recover very soon. So this is because of the acroarterial spasm. Using phentolamine, because this drug can induce vasodilation depending on blockade of alpha-1 receptor, so it can improve this blood circulation. So it is helpful. But of course now there are some other agents like calcium channel blockers can substitute these drugs in the treatment of this peripheral vascular occlusive disease. The second is this drug, phentolamine, is also used to treat local vasoconstrictor exercise, like norepinephrine, when it has instillation outlet leakage, outlet leakage as local error of administration. Maybe because of alpha-1 activation, it can induce vasoconstriction because the cutaneous tissue contain too much alpha-1 receptor. So the blood vessels there will contract very tightly. Maybe it will induce ischemia as a local error. So at that conditions, you should use phentolamine, to block alpha-1 receptor in the blood vessels at the local area. So, phentolamine, this is antagonist, and it is a competitive antagonist. It will compete to bind to the alpha-1 receptor with norepinephrine. So to correct this result is very helpful. Next one, phentolamine. For Pheochromocytoma for this disease is very useful. It can be used to treat and diagnose, even for pre-operative management is really helpful. Now, actually, this pheochromocytoma, it is one kind of a tumor in adrenal medulla. I think you know. Adrenal medulla, this area, its function is secrete epinephrine or a little, not epinephrine. This substance can activate alpha and beta receptor in the body, so induce some effect on the especially cardiovascular system. So when this epinephrine is too much secreted from adrenal medulla, so the patients with pheochromocytoma usually has very serious hypertension, tachycardia, like that. So use this drug to prevent hypertensive emergencies because it can block alpha receptor, induce vasodilation to decrease blood pressure. It is very useful. So prevent acute hypertensive emergencies is very useful. It also can be used to diagnose this disease because after using this drug, a greater drop in blood pressure yearly. Alteration of blood pressure is like this within 2 to 4 minutes after administration of phentolamine, intravenous injection. Some patients, once the blood pressure alteration change in several minutes so fast, it can be diagnosed by this disease. But of course, till now, in the diagnosis of this disease, some like imaging diagnosis is more important. Yeah, like ultrasound or CT cancer, scan is more useful. So, but after studying pharmacology, you should know this drug can be used to diagnose this disease. Pre-operative management, this is a kind of tumor in adrenal medulla. The best treatment is to remove this tumor from the body. So operation is necessary. But before operation, the heart rate and blood pressure should be at the normal state. So we usually use this drug, phentolamine, to maintain this like hypertension decreased to the normal state. So this is pre-operative management by phentolamine. And this drug, it induces vasodilation, decreased blood pressure. It also has positive cardiac effects. So both these results are beneficial for shock, which is featured by vasoconstriction, with resultant decreased tissue perfusion. Especially this drug can decrease pulmonary circulation resistance to improve pulmonary edema. It is really helpful. And some doctors advocate use this drug in combination with norepinephrine. Norepinephrine, and it can activate alpha receptor, but phentolamine can block alpha receptor. But both of them has positive effect on the heart. So some doctors just advocate like this, use in combination, but not everyone. But notice, use phentolamine after increasing blood volume. Understand? It has effect on the blood vessels is vasodilation. Should make the blood volume is enough, increase blood volume. After that, you can use phentolamine. Otherwise, because of vasodilation, it will further decrease blood pressure. Yeah. It also used to treat acute congestive heart failure. Because this disease, the patients with congestive heart failure, it usually has inadequacy of cardiac output. Because of decreased cardiac output, this will induce a body response, increase sympathetic tone. So now epinephrine released from sympathetic nerve fibers, it can induce vasoconstriction. So increase peripheral resistance. The increased peripheral resistance for the heart, it means increased cardiac work, increased preload and afterload. So it can cause pulmonary congestion and edema. Phentolamine does not aside, it can decrease pulmonary circulation resistance. So it can improve pulmonary edema. So that's why it is useful to reverse vasoconstriction in the treatment of this CHF. It also is very helpful. So how about the adverse effects of phentolamine? It also related to vasoconstriction caused by phentolamine and the others effect on the iron receptor or histamine receptor. Yeah. Because of blockade of alpha-1 receptor in the blood vessels, after using phentolamine, the patients maybe occur postural hypotension. Do you know the meaning of this? This hypotension usually caused by posture change, like from sitting down to standing up, like that. Yeah, some patients will have hypotension, so blood supply to the brain tissue is enough for a minute. Yeah, because actually the blood pressure, with the body posture change, the blood pressure also has a little alteration. This usually regulated by sympathetic nerve, depending on activation of alpha-1 receptor. But here, this is alpha blockers. So phentolamine block alpha-1 receptor in the blood vessels. So usually the patient has posture hypotension, and has positive effect on the heart. It can increase heart rate, even induce arrhythmias, increase oxygen consumption from the heart. Maybe here to also induce angina pain, induce attack of angina pectoris. Because it also can activate M receptor, some persons maybe have this reaction, gastrointestinal irritation. Phenoxy Benzomine. This drug differs from phentolamine. Phentolamine, just now, it is a competitive alpha-1 receptor antagonist. But Phenoxy Benzomine, it is irreversible and non-competitive alpha receptor blockers. It also induces vasodilation and positive cardiac inotropic effect. This result is similar to that of phentolamine. But because of irreversible blockade on alpha-1 receptor, it has relatively longer duration than that of phentolamine. It also can be used to treat pheochromocytoma prior to surgical removal or chronic management, or used to treat peripheral vascular occlusive disease like renal disease or frostbite. Phentolamine, because of positive effect on the heart, although it induces vasodilation, it cannot use to treat hypertension. But this one, selective alpha-1 blockers, pyridoxine, it is very useful. This drug has a relatively higher affinity for alpha-1 receptor than alpha-2. So compared with phentolamine, it has relative absence of tachycardia, leads to relaxation of both arterial and venous smooth muscle. So it induces decrease of blood pressure. This effect is very obvious. Because of these effects, pyridoxine usually it used to treat hypertension and congestive heart failure. When you study the drugs for hypertension or congestive heart failure, in that 2 chapters, you will study pyridoxine again. But pay attention about this. Pay attention to the first dose effect. After using pyridoxine in the treatment of this disease, especially it after first dose, the first time of administration, it also induces orthostatic. It also means postural hypotension. It can exaggerate orthostatic hypertension. So try to avoid this. So suggest the patients administer this drug at the first time before sleeping. So it also has a modest improvement in lipid profiles and glucose metabolism. This result for the patients with hypertension and congestive heart failure, it is very good. Because many patients with hypertension or heart failure, cardiac disease, maybe they have some problems of lipid, glucose like diabetes. Tamsulosin. This drug also is one selective alpha-1 receptor antagonist. It has relatively higher selectivity to the prostatic glands. So it mainly used to treat benign prostatic hyperplasia to improve the patient's symptoms, promotes the urination, to relieve the difficulty of urination in these patients. Okay, that's all for this part. So in this part, you mainly studied alpha receptor antagonist. So do you know beta receptor antagonist? Go to study next topic. You will get the answer. Okay.